All right. Well, why don't we go ahead? We'll just
We'll
do
start.
introduce our topic. We'll start here,
Mhm.
and I'm going to go ahead. I'm going to stop sharing my screen. All right, Bird, if you want to go ahead and get started, maybe a little introduction
Yes.
of who you are and what you do.
Mhm. My name is Byrd Scoss, and I'm a registered dietitian. I work with women in midlife who feel overwhelmed by the changes that are happening in their body, use diet and lifestyle changes to lose weight, get their energy back, and feel more like themselves again.
Fantastic. And
Mhm.
I'm Nicole Farr. I'm a certified personal trainer and health coach. And I specialize in helping women over 40 have more energy through getting better sleep, movement, and nutrition, how it all comes together to have more energy to actually live the life that you want to be living in this season of life. So we're happy to be here and tackling some of the hottest discussion topics that are out there month to month. And this month, we are continuing our discussion on a lot of myths, a lot of trends,
Mhm.
mixed messages.
Mhm.
I think it's pretty common. We see this if we're on social media, mostly in
Yeah.
our feeds, but it also comes in the news, in newsletters, in articles that we're
Mhm.
reading
Mhm.
every day.
Yeah, I think, and we were thinking this month to talk about hormones specifically, um, for obvious reasons, but really looking at what is being touted out there online and what's being sort of peddled, I guess, as products to support different hormone situations. Um, and I think that we just wanted to look at a few of the big ones that we've seen occurring over and over again. And the biggest one, I don't know if it's the biggest one. It's not the biggest one, maybe currently, um,
Mhm.
is adrenal fatigue, this concept of adrenal fatigue. And the understanding is that when your cortisol levels are high for a long time, where they're made, which is your adrenal glands, gets sort of like fatigued by making so much cortisol, leading to things like your body fatigue. And so we just sort of wanted to talk about that and what we think about it, and do you want to, I mean, I don't know if you have initial thoughts and I can follow you up, Nicole.
Well, again, good place to start because I
Yeah.
think that the term and the hormone cortisol, yes, midlife, we're talking a lot about estrogen and progesterone, but I think cortisol is kind of the next big one as far as hormones go in that discussion.
Mhm.
And there are definitely, again, lots of trends, lots of people talking about cortisol and how to bring it down and how it's affecting us. So I think this is a good place to start for sure.
Mhm.
Yeah, and I think we something really important to remember is we have cortisol, we have those stress hormones for a reason, and we actually need them for a reason for
Mhm.
those short spikes. Again, it's kind of that energy.
Mhm.
We need it in our fight or flight response.
Mhm.
Again, it's good when we're working out some of that short-term stress. There are some, small cortisol spikes when we're working out.
Mhm.
Again, of course, when we're getting when we are feeling, kind of pressure on us because it helps kind of give us that energy and that boost
Mhm.
to get past the initial stressor that we're feeling.
Yeah.
And I think a lot of the concern out there and a lot of the talk is that we're not actually the short term stress response is no longer short term, is that we're staying in a stressed
Mhm.
state
Mhm.
for longer periods of time, day in, day out, maybe,
Yes.
and kind of feeling that burnout
Yeah.
cycle.
Right. And also people associate like a really elevated cortisol, chronically elevated with the accumulation of belly fat. There's a little bit of truth to that, but that's in really extreme situations. I think for most of us, the fatigue component specifically um, is not, well, in terms of adrenal fatigue, the term adrenal fatigue is not a recognized medical diagnosis. So, um, your adrenals, make lots of hormones and they continue to do that throughout the course of your life and they don't slow down. So,
Mhm.
so, and if they do, then it's really more severe concept of adrenal fatigue. It's adrenal insufficiency, which is Addison's disease, which is a rare and serious disease. But I don't think that's what we're talking about, especially when we look at social media. I mean, I think the messaging is about feeling fatigued and contributing that to, slowing down or tired adrenal glands. So we just wanted to talk
Mhm.
about that because, because I mean, as Nicole, you pointed out before in our conversation that we were having earlier, there's almost always a product tied to these messages, and so I think that people do what's the word capitalize on people's, sort of fear about what's going on with their bodies when it comes to fatigue, especially at this age. And this is one response or one, not solution, but explanation that doesn't really hold weight scientifically. So from my perspective, there are lots of other things that are probably going on if you're feeling like you have adrenal fatigue, including disrupted sleep, stress, anxiety that comes at any time of life, but can get worse in midlife, iron deficiency, thyroid problems. So there can be lots of explanations for this kind of fatigue that people are attributing to adrenal fatigue that are actually things that should be addressed in a different way. And I think cortisol like rises and falls throughout the day, all day long. So just wanted to say that I know that there's also I think adjacent to the adrenal fatigue is cortisol testing. I don't know, they often speak about them together. So that's not really useful for the average person. I just wanted to throw that in there. Yeah.
Yeah, and kind of like you said, making sure, and really that's what we're here for, and why we're doing these monthly discussions is kind of helping you to be more informed about, yes, a lot of the topics out there, but also helping you decide what's right for you and what's right for you to maybe take to your provider or to
Mhm.
see. So if there is something that you're really questioning, we want to make sure you have the right questions and the right resources so you go in informed
Mhm.
and not necessarily, again, thinking that what you're seeing on social media, what you're reading in these newsletters is the absolute truth, because
Mhm.
most typically it's not. There's something else going on, and it's worth a really, a good discussion with your provider or somebody else that maybe can guide you in the right direction.
Mhm.
Of course,
Yeah.
again, that's what we're here for. We're happy to be guidance and provide resources
Mhm.
to get you moving in the right direction.
Yeah.
But again, coming back to, a lot of what we're seeing is, again, when it comes to adrenal fatigue, when it comes to a lot of the topics we're going to address today, is they're tied to sales. You get to the bottom of, whether it's the caption, the end of the newsletter, and they're going to be touting a supplement or a lab test or something special
Mhm.
that maybe you haven't even ever heard about. But that's where a lot of the questions come from. And a lot of, again, adrenal fatigue, it's not a medically diagnosed issue.
Right.
Yes, stress definitely can affect so much fatigue, brain fog. That is stress, but it's not necessarily tied to actually what your adrenal glands are doing.
Right.
It's tied
Right.
more to the stress of lifestyle.
Right.
And that's something that should be addressed versus
Mhm.
take a supplement's not going to help that.
Right, right,
So,
right. So I
yeah.
think I think we might both agree that rather that it's to skip the $80 adrenal support supplement and instead ask yourself, am I sleeping? Am I eating enough protein? Am I moving my body enough? Um, and then have my thyroid and iron and vitamin D levels been checked if fatigue is significant? So it's something that you might want to bring to your provider before you put your credit card down to buy and I'm not even sure what they put in adrenal support supplements. So uh but I don't imagine it's helpful. I can't say that because I've never tried it, but and I understand the appeal of wanting to try something like that, but I think the better move and probably the more effective thing is to talk to your doctor about it and evaluate your own lifestyle.
Yeah. Yeah. As Byrd just said, kind of looking at some of those foundations, are you sleeping well? Again, and looking at, just movement, nutrition, but also your own stress management practices. And I like to bring this up, and I
Mhm.
think it's super easy, especially for us women, to get so caught up in our day-to-day lives and what we're doing. If we have kids, if we're working, if we're juggling it all, caring for others. Um, it's really easy to get caught up in that and and to stop paying attention to ourselves, kind of put ourselves to the side and put our own kind of stress management to the side. So I know it can be really challenging. And this is, I hope a lot of women try to discover where they can find that small amount of space in their life, even on a daily basis, to take a deep breath.
Hmm.
Again, maybe movement is getting outside and taking a quiet walk. So movement can be your stress management gift to yourself. So just again, kind of finding those quiet spaces. Maybe if you don't like to get out and go for a walk, that's not part of, your day, maybe having just a quiet cup of coffee or a
Hmm.
quiet cup of tea in the afternoon, just
Hmm.
allowing yourself 5 minutes of space can be huge.
Yeah, totally agree. Yeah, I think that's super important, and it feels really impossible sometimes, but really, it's possible. 5 minutes is possible for most people, I think. I hope.
Yeah, well, it's yeah, again, pick up your phone and look at what you've been scrolling or
Oh,
messages that you've been checking. There's
yeah.
probably at least 5 minutes you can take from
Right.
that and give it back to yourself with a little bit, undistracted, even just quiet time to. Um,
Probably a lot more than 5 minutes is my
yeah,
guess.
right, right.
I also, um, moving on to the next thing that I think is a big deal right now is the concept of bioidentical hormones. And these sort of confuse me. Like when you think of bioidentical hormones, Nicole, what do you think it means? Do you?
Um, from my perspective, and I'm not, I'm definitely not an expert in this topic as well. But when I kind of hear that term and when I think about that, it is, how science has kind of developed, whether from natural sources or even chemical sources, hormone replacement that matches our natural. So,
Yeah.
estradiols, the specific types of estrogen. There's three different types of estrogen. So kind of matching, those individual types of estrogen. Again, even the testosterone, the progesterone. So kind of manufactured that
Yeah.
matches our body. So if we need that hormone replacement therapy, it's the closest match to our natural that science can get to at this point.
Yeah.
That's my take on it.
Yeah. Yeah. I mean, that's what I first when it took me a while to understand. I think the conversation about bioidentical hormones, because that's what it is. I mean, that's just what it means. The molecular structure of the hormone that's created is the same as ours. So, it responds and interacts with receptors in our body for estrogen, for example. But I think maybe the conversation is more about like about our people maybe are identifying bioidentical with a more natural form of these these molecules um, that are compounded versus it seems to the conversation seems to be between like compounded, personalized to you versions versus the standard FDA approved versions that your doctor prescribes. Do you think that, I mean, because that's sort of how I'm interpreting it. Um, and I just wanted to just point out that the bioidentical hormones, like I just said, all of them, whether they're compounded or not, are built to be mimic to the molecular structure of the hormones in our body. So that occurs in both the compounded and the FDA approved hormone therapies. So in that regard, they are both bioidentical. And often even the FDA approved, therapies are often derived from like natural things like plants. So I think people just sort of shy away, like had this sense that like standard FDA approved hormone therapy is not as natural, or maybe it's not as tailored to them because if you compound a hormone, then you can, specify dosages and that kind of thing. You can also use it in different forms. Like some people will get a pellet, implanted under their skin after their doctor's done some blood work and determined the levels they think would be appropriate for whatever hormones they're putting in the pellet, and then it stays in there for a few months. And that can be really appealing for ease of use and for that personalization effect. But And my issue, well, my issue with the pellets is it's not an issue. I think it's can be handy, but once it's in there, it's in there. So if you require a dosage adjustment or something like that, you can't really do that until it's worn off. But I think the bigger thing is that compounded hormones are not FDA approved, and the dosing can vary from batch to batch, and they're not tested the same way. And so even though sometimes like individualized dosages are needed for things like if someone has allergies or needs unique dosing for whatever reason. Um, but I think that largely, yeah, it's hard for me as a healthcare provider to recommend something that's not regulated, I guess. Does that make sense?
Yeah.
Yeah.
Yeah, no, that really does. And thank you for that. And I think that is really important to point out because it does sound very enticing when we, I think, personalized, customized, those terms when we
Yeah.
see them out there, especially when it's coming to hormones, when
Yeah.
it's coming to us and something that we need to take care of. I think that is very enticing. And that sounds, we probably all would look at that more than
Yeah.
just, oh, here's just the straightforward, like you said, FDA approved. But I think that's something very important,
Yeah.
is recognizing it that those specific kind of hormone replacements, the bioidentical, the compounded are not FDA approved. So again, we just don't know the long-term safety of
Mhm.
something like that. And that's where the concern is. It's just
Mhm.
not, it's something that's newer in recent years that has come out in the conversation, but we
Mhm.
just don't have the research pointing to long-term safety. And I think that's always, really what we
Mhm.
should be paying attention to when something comes into the marketplace, when it's starting to come to our attention. Is there, have there been, clinical trials done? Has,
Mhm.
is there some sort of a safety measure for long term, not even just that we're taking it today, but what are those long term effects? And a
Yeah.
lot of the stuff we just don't know what that is. So it makes
Mhm.
it really iffy. And like you said, as a provider, very hard to
Yeah.
recommend something like that
Yeah.
because of those concerns, those long-term safety concerns.
And I think, I mean, I think overall the research has not shown that compounded bioidentical hormones offer benefits over common commercially made medicines. And so, I mean, I think from my perspective, the more important question to ask is not, is it bioidentical, meaning is it compounded, but is it FDA approved? And, why are you recommending this product for me specifically? It's understanding what the hormones are supposed to do themselves rather than worrying about having them tailored to you from a from a place that isn't doesn't have very much oversight, you know.
And I think that highlights again really having that important conversation with your provider, with a trusted
Mhm.
provider, whether it's primary care, whether it's your OBGYN. Maybe you have a different level, of a provider that you go and see. And I think it's worth that conversation
Mhm.
with a trusted provider versus just jumping all in. You brought up some great questions like, why are you recommending that level of hormone for me? What are the positives? What are the negatives?
Mhm.
So I think it's super important to any of these kind of questions that are coming to mind is, I like to always say, write them down, write your
Mhm.
questions down and take them
That's
to your provider. So you can have a really well-informed conversation and then you can make the decision if
mhm.
it's right for you.
Yeah, I agree. And I think and that it sort of speaks to the at-home hormone testing that is also very popular now. Um I think I believe it's my understanding that there are at-home urine tests that you can do that might even measure your hormones over a few days. And then there are like mail-in blood draws that you do like one time and you mail it in. And I think women are using that to try and determine whether or not they're in perimenopause. Um, and again, like any of these things, I understand the appeal of that, especially if you're like, all these things are going on, and how do I know if I'm in perimenopause or not? Um, and there are some big companies that are making things like these urine tests, for example. But but the urine test specifically usually tests follicle stimulating hormone, which typically increases before menopause, but also increases before you ovulate. So even if you track it over a few days, it's not very helpful for determining or maybe at all helpful for determining if you're in perimenopause. And the blood tests, I think, is look at follicle stimulating hormone, luteinizing hormone, estrogen. Um, and that's a moment, that's one pinprick, one blood draw at one moment in time. And your hormones are fluctuating, literally every day, and going up and down. So it's difficult for one blood draw to give you meaningful information. But I thought of this because I think you're right. This is a place where you could go do an at-home test and take the results, and that might be a good jumping off point for talking to your doctor, and be among the things that you bring with your list of questions, to have that conversation. Because again, this is very individualized stuff, really. But perimenopause, according to the Menopause Society and the Endocrine Society, should be diagnosed clinically, meaning like they take into consideration your age, your menstrual changes, your symptoms, and your history, and they don't typically, or that's not true. Some physicians order blood work, um, maybe to rule out other things like thyroid problems or premature menopause, but generally speaking, the practice is to take those other things into consideration if they're trying to diagnose it,
Yeah.
Yeah.
And yeah, that's definitely a conversation that I've had with others before too. Again, from that educational standpoint, is understanding, especially in perimenopause, because that's what it is. Our hormones are fluctuating constantly.
Mhm.
So every day, every hour, we
Mhm.
might have a different reading on that lab test. Sure, you might get one, you might do one day and okay, you're in perimenopause. The next day, it's going to tell you you've got 30-year-old, ovaries, or,
Right.
it's like they're still producing, because just the way that fluctuation is. And that's exactly what perimenopause is. So,
Mhm.
um, I think a really good kind of message to take away here is don't do this alone.
Yeah, right. Yeah.
Don't take those lab tests and believe 100% of what you're getting. Don't make that decision about hormone replacement on your own if you're just hearing stuff and you decide you need something. So you even go to, uh, you know, uh, a telehealth site. There's plenty of those popping up these days,
Mhm.
and they kind of prescribe things with
Mhm.
just at free will without really knowing all of your history. And so that is definitely not a recommended process. Maybe a jumping off point if you are
Yeah,
interested
that's
in
a good
learning with
point.
that, but taking that to your provider, taking that to someone you trust to have that conversation. So don't jump into any of this alone.
That's so. I'll just share something
And you don't have
personal.
to. Yeah.
Yeah, I personally, when I didn't know that I was going through perimenopause, used one of those sites, and I got estrogen prescribed to me, and then I took it to my I couldn't get an appointment with her for a long time, but I was like suffering, and but that's how I did that, and it's not what I would recommend people to do as a clinician. And I'm just a human being, so I'm just sharing
Learn
that
from that
because
experience.
right.
Yeah.
Right, because ultimately the best thing was for me to go to her and tell her that I'd done that, and then have her, look at what I was taking, and make some adjustments. But you're right, it was a good. It's like I can see it helpful as a jumping off point, but I think that ultimately you really want to start the conversation with your physician if you can, if,
E-
if you can do it.
exactly.
Yeah,
Exactly.
yeah.
Yeah.
Um,
So
I
so
think, yeah.
I think
You
that
go ahead.
might be a great place to just kind of start to wrap up
Mhm.
our conversation. I feel like we kind of tackled a lot of what we really are seeing out there
Yeah,
already.
yeah,
Oh,
yeah, me too. And then you had mentioned earlier, like, that the idea that it's hard now. So many things are attributed to perimenopause, all these change, feeling like joint aches, ear itchiness, frozen shoulder, fatigue, all of these things that are, women are starting to worry that, like, oh my God, Is this menopause? Is this menopause? And so you were saying earlier, Nicole, that that it seems like every symptom is perimenopause now, or that there's this feeling that, it sort of feels like it's the newest health scare to me. And right, and I don't know. I just want to say that there are your symptoms are real. And sometimes menopause explains them, but sometimes it's just part of the explanation. And sometimes it's something else entirely, So encouraging, yeah.
Yeah.
I want you
Yeah, well, like you said, perimenopause is kind of the latest scare tactic out there.
to.
The diagnosis to be the most fearful, and it's not. It's just like puberty. It's just that phase of life.
Mhm.
Going in, making sure you have questions, ask questions,
Mhm.
allow yourself to be informed. I mean, I think this is a good place, even if you're in your mid to late 30s, start to inform yourself, start to recognize things that are going on. Menopause also happens later and later, for a lot of people. So even into your 50s, know what's going on. And I would say those beyond that, there are, things can still be, hot flashes can still happen, things can still happen, even on the other side of menopause. So just recognizing that, but super important having those foundational practices that Byrd touched on a little while ago. We both kind of talked about that. It's kind of your first line of really understanding what's going on with your body. Kind of ask yourself, are you sleeping? Are you paying attention to yourself and taking care of yourself with good stress management practices?
Mhm.
Are you having even just, some baseline movement in your life? You're not just completely sedentary. And, are you trying to at least, pay attention to your nutrition? You're not just out there going through the drive-through for every meal. You're having, some nutritious meals. If you can kind of get those baselines, I think that's going to answer, a lot of questions for you, even having that before having to go all in
Mhm.
on, with your doctor, or again, kind of getting lost and confused with a lot of the trends and recommendations that we see out there.
Yeah, I think that's great advice. And I would just like to share some resources because if you do want to do more research, some good places to do that are with the Menopause Society, formerly known as the North American Menopause Society, the American College of Obstetricians and Gynecologists, and the Women's Health Initiative follow-up publications, which continue to find they're the ones who published the 2002 study, which continue to refine their original findings and have really good information about hormone replacement therapy specifically, but also a lot of other topics for women going through this transition.
Fantastic. Thank you for
Yeah,
sharing those.
you're welcome.
Yeah. Yeah, and again, just knowing that you don't have to do this alone, and we're here for you. We're here to provide you with resources as you need them, guide you the best that we can. And again, even just kind of answer questions if you're feeling really overwhelmed by the amount of information out there. I know both Byrd and I do offer consultations, complimentary consultations. So we can even begin to help you dig through some of that noise and helping you find what is best for you. That's a great place to start. I
Yeah,
just put our information up on the screen. So if you'd
yeah,
like to have a further conversation with either one of us, please feel free to reach out.
absolutely. Love to hear from you.
Yeah.
Mhm.
All right. Well, I think we've kind of wrapped up our
Yeah,
conversation. So
perfect
we'll let
timing.
you go for the day. All
Okay.
right.
All right. Bye-bye.
Bye bye.
Bye.